The way you test for hydrogen sulfide, there's two ways. We now have the fabulous direct test, and it's TrioSmart. And I don't know if it's available in Canada. It may not be yet, but it's here in the US, created and validated by Dr. Pimentel, offered by Gemelli Labs, and it's called TrioSmart, and it tests hydrogen, methane, and hydrogen sulfide. So that's the main way we would do it. The next way we would do it, the way we've always done it all along, is we order a standard 3-hour lactulose hydrogen and methane breath test. It needs to be a 3-hour, because then what we're doing is we're looking to see if hydrogen and methane, but more so hydrogen, is like basically negative and close to a zero in the 3rd hour. That's why you have to do it for 3 hours with lactulose. It has to be. And then that's called a flat line pattern. And the concept here is that hydrogen, it should be low in the small intestine normally, but it should rise in the 3rd hour because we have a lot of bacteria. The 3rd hour represents the large intestine, and we should see that. We should see that we're making some gas in the large intestine time zone, because we have tons of bacteria in our large intestine. And if we don't, then we presume that what is happening is the hydrogen gas is being converted into hydrogen sulfide, and we're not testing hydrogen sulfide. And so it looks like there's no gas. And this usually we expect to see the methane fairly low too, because the concept would be that it's all hydrogen sulfide. So the flatline pattern is when hydrogen is all zeros or close to all zeros the whole 3 hours of the test, and also that methane should probably look low as well. But we're really looking at the hydrogen. The problem with this is now we know that all 3 gases can exist all at the same time. So this is only one version of a positive hydrogen sulfide. We really understand now how limited we were, how many people we were missing by just using a hydrogen and methane flatline test pattern, but it's all we have unless you can test the gas directly.